Joining us now, the director of Vaccine Education Center and an attending physician in the Division of Infectious Diseases at Children's Hospital of Philadelphia, Dr. Paul Offit. He's also a member of the FDA's Vaccine Advisory Panel. Dr. Offit, I'd like to start with, can you explain mask-wearing guidance and the potential for vaccine mandates? I guess the big question is, what is the danger of the Delta variant continuing to go through the country? Why must we prevent it?
Right. Well, the Delta variant is far more contagious than the first two variants that came into this country. The first one, the so-called D614G variant, swept through Europe, swept through Asia, swept through the United States, killed 500 million, killed 500,000 people here. Then the second variant, the Alpha variant, you shed 10 times more virus than you did with that first variant. With this variant, the Delta variant, you shed 1,000 times more virus. It's highly contagious, and that's why it seeks out an unvaccinated population. I think what changed, I think what surprised us all was that a few months ago we were vaccinating 3 to 3.5 million people a day, and the assumption was that we would continue to do that people would see this vaccine for what it was, which is a ticket out of this pandemic, and instead we fell off a cliff. So we have actually fewer than 50% of the population vaccinated, which is far less than we need in order to stop spread. I think that the Delta variant and just a disappointing uptake of this vaccine has put us in this position.
Doctor, let me read you what Mark Thiessen, a former chief speechwriter for George W. Bush, has written this morning in the Washington Post. Vaccinated Americans are more likely to die from a lightning strike than COVID. Don't bring back restrictions. It says this in part. The data is clear. According to the CDC, as of July the 19th, a grand total of 4,072 vaccinated Americans have been hospitalized with symptomatic breakthrough infections out of more than 161 million who have been fully vaccinated. That is a breakthrough hospitalization rate of less than 0.003%. Better still, of those hospitalized, only 849 have died of COVID-19. That means the death rate from those breakthrough infections is 0.00005%. To put that in perspective, your chance of dying from a lightning strike, about the same, 0.0007%. And your chance of dying from the seasonal flu is 0.1%. If you're vaccinated, you have a much greater chance of dying from a hornet, wasp, or bee sting, a dog attack, a car crash, drowning, sunstroke, or choking on food than you do of dying from COVID-19. Mr. Thiessen goes on to say that those who die even after being vaccinated, those small numbers who die have underlying conditions. So if that's the case, why should there be a mask mandate for those who are already vaccinated if they have less of a chance of dying of COVID after vaccination, which is, of course, great news, and I know you'd agree with me on that, than dying of a bee sting?
Well, so the vaccine works to protect against severe critical disease. If you're vaccinated, it's extremely unlikely that you're going to be hospitalized or die from this virus. But this is a mucosal virus, and like all mucosal viruses, like influenza, rotavirus, you're not as well protected against asymptomatic infection or mildly symptomatic infection, during which time you can still shed virus and be contagious. So you're asked to wear a mask to protect not so much you from having severe critical disease because the vaccine protects you. It's to protect others who come in contact with you who aren't vaccinated, where you may still shed virus asymptomatically and infect them. I mean, when I walk into a grocery store, which I did yesterday, pretty much nobody's wearing a mask. I mean, I think a lot of those people are unvaccinated. I protect myself and protect them. I also don't want to get mild infection, which may also cause longer-term consequences. So I think for right now, I think when the CDC says we should have a mask mandate for schools, I think that's exactly right. Because otherwise, what you're doing is you're asking the schools to sort out who's been vaccinated and who's not been vaccinated, which is too much to ask. It's too bad we're at this position. I think we've let our children down. There's no reason we shouldn't be at 80% immunization rates right now, and we wouldn't be having this discussion. But people have just chosen not to get this vaccine, which is why I think that the discussion over the next 6 months is all going to be about mandates.
Yeah, and I wonder if those people cheering at CPAC because we hadn't reached 90% are still cheering. If they are, well, shame on them, because it's children who are going to be suffering because of it in large part. I can't let you go without asking you about the FDA's final approval of these vaccines. Since you're on the FDA Vaccine Advisory Council, I know that decision's not in your hands, but I am hearing from people who are saying, I'll get the vaccination as soon as the FDA grants final approval. The Wall Street Journal editorial page this morning is basically saying, come on, in a pretty well-reasoned, thought-out editorial, saying, come on, FDA, a lot's riding on this, fast-track this as quickly as you can. How soon can we expect FDA approval for Pfizer, since that seems to be the one in the front of the line?
All right. So when the FDA licenses a product, they do a few things. They don't just license the product. They also license the building and they license the process. In order to license the process, they have to validate every aspect of the manufacturing process, look at the protocols, and that actually takes a lot of time. I was fortunate enough to be involved with development of a rotavirus vaccine at Children's Hospital of Philadelphia. That validation process took a year. Now, the FDA is working around the clock to try and get this done, and I'm optimistic it could be done by mid-September. But know this, there really is no difference between an emergency use authorization or licensure, in that emergency use authorization technically means that you can distribute an investigational new drug. This is far from an investigational product. I mean, we have a safety and efficacy and immunogenicity profile that involve more than 300 million doses. That's more than most already licensed products that are out there. So it's really more psychological than anything else.
All right, Doctor. Thank you so much for being with us. We appreciate it. In a few minutes, Dr. Anthony Fauci will be our guest.